So let's talk about Medi-Cal now. And again, if you have any regional center questions, you can ask when we open our Q&A period. So you may have heard the words Medicaid and Medicare in discussion of public health care coverage, especially right now. Medicare is linked to Social Security, disability, and retirement benefits, and we're not really going to get into that today. Medicaid is need-based healthcare coverage that's linked to household income, and then there's also some programs to give people access based on disability and a few other factors. Each state runs its own Medicaid program, and it's funded by both state and federal funds. Medi-Cal is California's version of the federal Medicaid program. So when you hear people talking about Medicaid, in California, that's Medi-Cal. So there's four main ways that people are going to qualify for Medi-Cal as a person with disabilities. The first is modified adjusted gross income, which is income based. The second is if the person is an SSI recipient, and we'll talk a little bit about SSI later. The third is there's some specific programs that are still income based, but not based on the same criteria as the modified adjusted gross income. And then there's the 1915C home and community-based services waivers. If your child is a regional center client and you are getting Medi-Cal because your income is too high and they put you on what they call the regional center waiver or the institutional deeming waiver, that's this. So generally speaking, if you qualify based on income, you'll be on this first category. And if you don't qualify based on income, the regional centers have a mechanism. And there's a few other Medicaid waivers as well. There's also one for kids with medical or for people in general with medical complexities who aren't regional center clients. But generally, if you're not qualifying based on income, your child can still be potentially eligible for Medi-Cal based solely on their income through institutional deeming. And I just want to let you know if you see these QR codes throughout the presentation, if you take a screenshot, and we'll send out the slides and the recording, but if you want to take a screenshot, these all link to our expanded articles on each of these topics. So, for a little bit of light reading, feel free to click through and take a look. So